Yeah.
Yeah. Okay, I'd first like to welcome Dr. Aadil Chimthanawala, who all of you know is an expert in the field of homeopathy related to cardiology. I've had the opportunity to attend one of his seminars, and the knowledge that he's got is immense. And we hope he shares the information that we can use and heal people with homeopathy who's suffering from any cardiac problems. I welcome everybody for the fifth one, and I pass it on now to Dr. Aadil. Dr. Aadil, please.
Hello, good evening, friends, ladies and gentlemen, boys and girls. It's absolutely amazing to be on this webinar. Slight teething troubles from our side, but then it's over. And it's 7 p.m. in India. And today I've been given a topic of my choice, my profession, since I'm a homeopathy cardiologist. And that is homeopathy in cardiology. A huge topic to be covered in 30 minutes. I'll try to give you a bird's eye view of what can be done, how should it be done. So friends, without wasting much time, since I have a limited amount of time, I'll not be able to share amount of cases, but then yes, over a period of some time, like next time or so, we'll take each topic in details. See, various types of cases comes to you. First of all, let this concept not be there that homeopaths cannot treat heart disease. It's like any other disease. If you can treat asthma, if you can treat sinusitis, if you can treat skin disorders so effectively, then why not heart? Heart ultimately is just an organ. So I believe that you should be able to treat heart disease. In fact, I always say that many people, moment they hear the word wart, any wart, be it an allopath, be it a layman, the first thing that comes to mind as far as remedy is concerned is puja. They don't even know that puja has only a very peculiar type of wart. They don't even know that puja can cure a wart or not. But puja comes. I hope the day will come when you hear of heart disease, the first thing you come on the lips would be homeopathy. Well, that's my dream. I've been seeing this since past 25 years, working on it since past 20 years, and hopefully I'm very, very successful in that. But then it should not be limited to me, it should spread all over. Anyway, having said that, the different disorders that a homeopath would encounter would be ischemic heart diseases, and that's my forte basically. Hypertensive state of disposition. So hypertension is different and hypertensive state of disposition is different. Valvular heart diseases, arrhythmias, heart failure, congenital heart diseases, infections, and heart affected because of other diseases like, for say, diabetes, autoimmune diseases, drugs, etc., etc. Let's get a bird eye view of ischemic heart disease and what homeopathy can do. Let us be very clear that heart contains blood, but it never steals blood from its chambers. That means it has its own blood supply from its coronary arteries. There are two coronary arteries, the right and the left. The left starting, moment it starts, it bifurcates into two, left anterior descending artery and left circumflex. So in all practical purposes, heart has got three coronary arteries. Now, whenever a person who's got tendency for atherosclerosis, meaning thereby that this tendency is an inherited tendency. It's a genetic tendency, it's a genetic trait. And if the circumstances are correct, that means in homeopathy you require two things. Number one is the exciting factor, as the horizon number 7 says so, causa occasionalis. Exciting factor, a maintaining factor. But before than that, you require a fundamental trait which is called as miasm. So suppose if I am afflicted with a tubercular miasm, which is one of the atherosclerosis is one of the expression of this tubercular miasmatic state. I'm sorry if people don't know about miasms, but then it is imperative that I use this word when a homeopath has to speak upon a topic like this. So if I'm afflicted by this tuberculosism and I have this atherosclerotic tendency, I will start manifesting by the age of 8 years. Not manifesting, start activating. The miasm can be activated by the age of 8, 9, 10 years. But for that, I would require some mental or physical exciting factor. It can be a shock, it can be insult, it can be divorce of my parents, it can be anything. Very painful mental this, and then the process starts. Now, what is this process? The process basically is fats should be collected in the liver. The liver then chooses where the fat should go. But suppose, apart from the liver, then they are slowly depositing in the safe oil. Suppose this pen is an artery, and the inner wall of the arteries, they start depositing. I'm just 8, 9, 10 years of age. Now, if I have got maintaining factors like bad diet, no exercises, a bad mental state, I mean, bad in the sense, that means a state conducive to atherosclerosis, sedentary lifestyle, then the process is accelerated. Accelerated means the deposition starts over a period of time when I'm 25, 30, 35 years of age. The deposition is sufficient to block the caliber of the diameter of the artery. And then I start getting heaviness if I walk a certain distance. And that the people, the cardiologist would call it as angina, angina pectoris. Angina means pain. You can have angina of the jaw, you can have angina of the chest, you can have angina of the abdomen. So if it's angina of the chest, is called angina pectoris. So we are loud and clear. But as the blocks keep on increasing, then you can have another increasing chest pain, what we call as unstable angina. But for a heart attack to occur, again I repeat, for a heart attack to occur, this block should be very loose, fragile, and should burst. And for that, it requires the permission of the human mind. That means to say that myocardial infarction or acute heart attacks are greatly related to the mental state of the patient. In fact, we have noticed that people invite a heart attack. My first question to people who have brought a heart attack is, why have you brought a heart attack? And they will straightaway deny. No, why should I bring my heart attack? No, unless you permit. Now, how can you permit? It's a very, very long pathophysiology. I can't explain it in 30 minutes. But suffices to say here that the mental state of the patient is a very, very important factor to not only maintain a heart attack, get a heart attack, but also maintain it. Angina can present in a varied form of manifestations because tuberculosism basically means a variety of manifestation. A soric manifestation is always sudden onset, violent, and functional in nature. A psychotic or syphilitic disease would be a very long-standing, gradually progressing disease which is without cure. But a tuberculosis can be volatile like SORA and can come down. So you can have chest discomfort or acute chest pain and typical cardiac pain, what we call Heberden's angina, because Heberden was the one who had completely discovered, mentioned angina. In fact, angina was the first thing was mentioned by Indians. Ritshula, H-R-I-T-S-H-U-L-A. Ritshula was first mentioned by Indians. We are proud of that. And an exact description of angina pectoris and acute myocardial infarction has been given in our Vedas, and that has over the generations been carried on with different languages. But then in the recent times, Heberden has described it as a centralized discomfort, not left-sided or right-sided. It's a centralized discomfort and not a pain, which starts from center and may radiate to the left arm up to the 2 fingers. This is the classical angina pectoris, but in fact, you can have choking, you can have suffocation, you can have jaw pain, right or left, you can have right-sided chest discomfort and pain, you can have epigastric discomfort and get burps, and you can have palpitations. So there are so many variations depending upon your other comorbidities like diabetes or hypertension, which can modify a symptom syndrome. The point of differentiation between pain due to heart disease and due to disease of any other organ is these heart disease symptoms are generally 90% accompanied by some autonomic nervous system disorder like excessive sweating, like urge to vomit, like urge for urination, like excess passing of gases. Now just imagine chest pain here and you want to pass loud gases. This is angina unless otherwise proved. During the past few decades, unfortunately, coronary artery disease rates in India and Southeast Asia have risen tremendously, and India unfortunately leads the world. And that is why we are here as homeopaths to talk about heart diseases in homeopathy. And not only India, India, Pakistan, Sri Lanka, Nepal, entire Southeast Asia, including Malaysia and the other countries surrounding it. Indians have greater prevalence. It is more or less a genetic disease, and the gene is, let's not talk about that. So, as I said, atherosclerosis begins early childhood. If you suspect someone with atherosclerosis, the simple test you do is a resting ECG, electrocardiogram, which normally comes normal in most of the people, sorry. But then if you tell them to do a treadmill, if you tell them to run on treadmill, you can get changes during the exercise. And that's how you catch for the first time that a person can be suffering from a coronary artery disease. Then obviously, echocardiogram and an angiogram can follow, and they will define the extent of the pathology. Homeopathic approach, target the person suffering from the disease and not the disease per se, always remains the #1 approach wherever, whenever it is possible. You take the mental generals of the patient, the appetite, the thirst, the desires and aversions for food, the sweating, the stool, the urine, the sleep, the sexual functions, and menses, the past and the family history, and then you try to select a constitutional similibum and ascending potencies, and you have a wait and watch policy. When you are giving this drug and ascending the potencies, be sure that the patient is hemodynamically stable. An unstable patient does not receive constitutional therapy, otherwise you can have killer aggravations. So when you're increasing the potency, at the same time, try to decrease the other medications like allopathy, like Ayurveda, like herbal therapies, etc. Try to shift them to more natural modes of life and living, more disciplined modes of life and living. Try to plan a diet, an individualized diet. Try also to plan an individualized set of exercise. For example, when I say individualized set of exercises, let me be very clear. We not only select a drug, a constitutional drug, only for giving it to the patient, but also to plan the diet and exercise. An Argentine Matricum craves sugar. Fine. And how much ever you tell me that, doctor, don't eat sugar, you have got diabetes, this is not good. I know, but what about that craving? And that formica craves alcohol, a sulfur cephalonym craves alcohol. So what you do is you give the drug and then you have to rectify that diet. As exercise is concerned, you know that Brian has aggravated the movement. Unnecessarily telling them to walk, take long walks is not correct. Instead, they can use yoga, they can use pranayama, they can use massage as a therapy. So if you have found out the constitutional remedy of a person, then don't just stick to giving it. Define your exercises and diet according to that drug of the person. That is called true homeopathy. That is called individualized homeopathy. That is called a holistic system of medicine. Like for that example, Terminal Arjuna is a fantastic remedy for this, but it does not suit many of the drugs. So it has to be a collateral drug, a cognate of a particular drug, like lycopodium. Lycopodium and Arjuna go very well. So when you have a lycopodium constitution and you have given a lycopodium drug, and then next potency you are going to repeat after say 2, 3, 4 months, because you have to at least wait for 3 to 4 months for your constitutional medicine to act. Till that time, you can give this drug, Terminal Arjuna, and it will start clearing off the plaques. So it's untrue that all patients who have been detected with blocks have to always undergo angioplasty or bypass. They are just last options. Cleaning up of the arteries or just bypassing the disease is not a permanent solution. But tendency of atherosclerosis to be broken is the permanent solution. At Aadil Homeo Center, Nagpur and Mumbai and Bangalore, we have set up a specialized cardiac center exclusively for such disorders since the past 20 years. Coming to hypertension, the costliest disease, and India is unfortunately the world leader in this disorder. Economic visits. We have got direct costs of screening, diagnosis, clinic visits, lab tests, drugs, adverse reactions to those drugs, transport cost, time lost from work. We never count all these things. Indirect cost, in income loss due to absence of work, cost of therapy for coexisting conditions. Rarely do I come exclusively with hypertension, a person with exclusively hypertension. You always have hypertension plus IHD, plus hypothyroidism, plus dyslipidemia, plus diabetes. Risk factors in Indians, what we have seen is truncal obesity. That means what we call Indians as lean obese. When you see an Indian, he or she looks thin, but you have got a huge abdomen, particularly in males, and females, you have got big bottoms. That they are problems. So truncal obesity due to hyperinsulinemia. Indians generally tend to have higher insulin levels. Tobacco chewing without line. Now, this is a very interesting study I had done in 1998. Tobacco, see, how much ever you try, you convince the person that's bad, tobacco is bad for health, and we know tobacco also is a instigating factor, a maintaining factor for hypertension and ischemic heart disease. Yes, correct. We have certain drugs specifically to withdraw the urge for tobacco. Yeah, but till that time they act. So let us tell them the type of alcohol they should drink or type of tobacco they should chew. So tobacco with the lime is better than at least raw tobacco. Smoking, post-alcohol snacks. Alcohol per se is not bad in our studies. Alcohol, in fact, is a cardioprotector. But problem with Indians is they don't just drink alcohol. They have alcohol along with snacks, and those snacks add a lot of calories along with alcohol, and in presence of alcohol, every single fat molecule is absorbed with alcohol and directly absorbed in the system. The body does not have the right to shun away those things. Now, we have got deficiency of potassium and fiber. Just imagine people living near the coast, like Chennai, like Mumbai, like Cochin, Goa. Fine, they can have common salt as their routine salt. But people living in, say, for example, Nagpur and plateaus, common salt is not found here. Why should we have common salt? Just because our palates are trained for having common salt, that's the reason? No. Instead, we should have rock salt. What in common language we call as Sendha Namak. Rock salt is very beneficial. Rock salt is potassium, and potassium and heart love each other. Potassium and kidney hate each other. Potassium and heart love each other. So if your diet rich in potassium, your cardiac disorders and at least particular hypertension is very well under control. Now, certain drugs like NSAIDs, painkillers, routine painkillers, OCPs, oral contraceptive pills, nasal decongestants, cyclosporine, erythropoietin, which is given in kidney disease to increase the hemoglobin, steroids, they are all responsible for a hypertensive state. For a pretty long time, so over a period of 3, 4, 5 years, hypertension or hypertensive state presents as vague symptoms like hypersensitivity. A person whose basic nature was not hypersensitive now starts becoming irritable, now starts responding badly to noises, some people's remarks, etc. They become more like staphysagria, ignitia, natremor, gelsemium states. They have irritability, mood swings, lethargy, fatigue. Initially, I could walk 4 kilometers with ease, but now walking 2 kilometers takes a lot of toll on me. Now, these are the starting of a hypertensive state. I don't want to think, but once a particular thought goes inside my head, day in and day out, it keeps on churning inside, and I don't know how to get rid of it. I try to meditate. The more I try to meditate, I close my eyes, and then the thought comes. Then I start eating more, or I don't eat more. I start regaining weight because of water retention. My sleep is disturbed. Recurrent vortex headache. This is a classical headache of hypertension. The typical vortex headache of low 9 is a very hypertensive state like headache. So you have a pretty long time. This, as the one year, 2 years, 3 years, or you go to the doctor many times. The time when you go to a doctor, your BP is normal, but at other times the BP can be very individualistic. Hypertension can be very individualistic. Some people can have only nocturnal rise of BP. Some people can have only early morning rise of BP. At that time, you don't go to the doctor and detect it. Some people can have only post-meal or post-sexual act rise of BP. That's it. Only in the evening. So that is a particularity of hypertensive disease as well as the individual. And that helps us to select a constitutional remedy for the hypertensive state as well as the individual. Multiple double-blind trials at our center, Aadil Homeopathy Center at Nagpur, have proved beyond doubt that homeopathy alone can manage hypertension and its complications as hypertensive heart disease or enlargement or stroke or coronary artery disease. We have prepared protocols for that. Again, as is true for ischemic heart disease, it is also true for hypertension that a constitutional treatment has to be done. Without that, there is no escape. We cannot always rely on symptomatic drugs. It will be like giving homeopathic prescriptions on, I mean, giving homeopathic drugs, but the prescription remains allopathic. But then, yes, sometimes you have to tackle that crisis, tackle that hypertensive emergencies, tackle, sometimes have to reduce the blood pressure. For example, PIH, pregnancy-induced hypertension. In the pregnancy, come what may, I have to reduce the BP. Otherwise, the child will die or the mother is going to go into convulsions, eclampsia of pregnancy. In that state, I have to use homeopathic drugs as we use in a hospital since the past 32 years. That somehow, so for that we have to somehow decrease the blood pressure, and that's why we have prepared many protocols. For ischemic heart disease, chest pain, different. For hypertension, we have got different protocols. But yes, being a lifestyle disorder, drugs alone cannot do your job. Counseling is important. Exercise is important. Pranayama is important. Yoga is important. Isotonic exercises like walking, jogging, swimming, racket games are more important rather than isometric exercises like weightlifting, etc., which should be basically avoided in a hypertensive patient. Cultivate a hobby. That's very important. Music, be it painting, be it writing poetry. Remove your thoughts from here. It is called mental catharsis. Now, however you want to present your thoughts, either you can't speak, start speaking out. If you can't sing, start singing. And you must try to relax on weekends. Non-smoking should be practiced as a social behavior. And the physician needs to find out alternatives. If the hypertensive female is on treatment using oral contraceptive pills, the male partner has to pitch in. Let's come to valvular heart disease. India, again, unfortunately, is the world leader for valvular heart disease. So what is valve? We have got 4 chambers of the heart, and each chamber is guarded by a gate. A gate is, in the heart disease or medical terminology, is called as a valve. There are 4 valves, and in some people, 4 valves. We have got aortic valve, we have got pulmonary valve, we have got mitral valve, and we have got tricuspid valve, each guarding its respective chamber. Now, in some people, either congenital or acquired, like rheumatic fever, one or more of these valves can become very stiff or ultimately calcified. Slowly, the valve's inner diameter reduces in size, and then the flaps which guard the valve become totally ineffective. So this occurs in quite a young age, from 5 to 15 years of age, which is the peak season or the peak time for rheumatic fever to occur. After 15 to 17 years, the incidence of rheumatic fever in India at least goes down. So symptoms are breathlessness. One of the first symptoms of cardiac disorder would be breathlessness on exertion. Breathlessness on exposure to cold air, to dust, would be more asthmatic in nature. But breathlessness on walking or climbing up steps would be more in favor of heart disease unless otherwise proved. Second would be unusual tiredness or weakness, especially on walking or doing some routine work or heavy work. Then it will be accompanied with vertigo, what we would go on to unconsciousness or syncope. Bluish discoloration or cyanosis of the skin. A particular cardiac cough. Not this is a metallic cough of lungs, but it's more of a cardiac cough. So many people may require long-term antibiotic treatment with penicillin, etc. But in India, although this rheumatic fever and rheumatic heart disease has been wiped out more or less in Western countries, but in India and Indian subcontinent, we have got loads of patients. In fact, many patients are still under a follow-up, and luckily for us, we have cured quite many patients. But even if you are not able to cure in the late stages of rheumatic fever or rheumatic heart disease, we can still help them. When they go on for heart failure, we can have drugs. We do have drugs like Spongia, like Naja, we have Spigelia. They're very specific drugs, Calmia, lithium carb, fantastic remedies. Even if they have to use as pathological prescriptions, I would recommend they're much more safer, much more long lasting, and much less side effects than the other drugs of other therapies. So, dear friends, let's shift on to heart failure. It's a dreaded complication of most heart diseases, either heart attack, untreated valvular heart disease, or chemotherapy nowadays for cancer therapy can lead to heart failure. And there are many, many reasons. Unfortunately, we have got this viral disorders, so many viral disorders, which can ultimately cause myocarditis and lead to heart failure. Heart function progressively deteriorates. The normal heart functioning in a healthy individual should be more than 80% when you see an echocardiogram, but then less than 30% is called heart failure. Breathlessness, again, number one on exertion. Edema, feet. You've got swelling on the under the lids, swelling on the feet, swelling over the hands, cough which is aggravated at night, urinary complaints, constipation, dry skin, and loads of other complications can occur with heart failure. Now, since India also tops the world in diabetes, persons suffering from heart diseases land up very frequently with more than heart failure than with any other symptoms, because it's a well-known proven fact that in ischemic heart disease of diabetics, they don't get angina generally. They don't get pain. So what they do is they land up directly with heart failure as the first presenting symptom of heart disease, of ischemic heart disease in diabetics. So Indians, be aware. Even if you are living abroad, if you have roots in India, then you have the genes and then you can have this process. There's a tremendous scope of homeopathy for chronic congestive cardiac failure. Strophanthus, Carbovec, Squilla, Fasciolus nana. I have presented numerous papers on all these things, and we have very, very documented proof how homeopathic medicines alone can increase the pumping capacity from 30% to 35%, from 15% to 30% and above. So why not try homeopathy? Arrhythmias. Heart muscles has its own electric supply. It does not depend upon the nervous system for electrical supply. But when these electrical supply gets disturbed, either the heart starts working too fast or too slow or irregular. And then comes arrhythmias. When arrhythmias come, unfortunately, in the modern school, we have got very limited drugs available and nothing less, but then they finally do a surgery, and not necessary that all surgeries would be successful. One of the common arrhythmias is atrial fibrillation. And again, in homeopathy, we have got documented drugs and very, very great amount of evidence as far as arrhythmias are concerned to treat arrhythmias. I'll not go in details because of lack of time. So yes, many patients have been awarded pacemaker just because they took homeopathy and could treat themselves with arrhythmias. Finally, is congenital heart disease. The incidence rises every day. With modern society, late marriages, when the females deliver late, that is late gravida, at the age of 33, 34, 35, and they have the first pregnancy, lots and lots of people have got Down syndrome babies, and not only Down syndrome, but they have got congenital heart disease, ventricular septal defect. There's a hole in between the ventricular the membrane, atrial septal defect, patent ductus arteriosus, tetralogy of Fallot. The list can go on and on and on. And all these put the life of the fetus and the newborn at stake, and not the baby itself. The parents of those babies are literally dead. They don't have life. They only cater to one single thing, and that is a permanent apprehension. Will my baby be ever cured? That's a very sad state of affairs. Very sad state of affairs. And we say that we have got surgeries. No, my dear friends. Not all babies are fit for surgeries. Not all adults are fit for surgeries of congenital heart disease, particularly when they start developing pulmonary hypertension. In multiparas, if mother has given birth to babies suffering from congenital disorders like TORCH, T-O-R-C-H, or with the VDRL positive, they've got syphilis or HIV, then the incidence increases more. What can you do with homeopathy? Yes, for the baby, we have got multiple drugs, simple drugs, Carbovec, again digitalis, you guys have got aconite, both Napalis and Ferox, Bryania. Fantastic remedies, Calcirifos, fantastic remedies to maintain not only the internal environment of the heart, but stop its deterioration. We can actually pull on years together for the people who cannot undergo surgery at this point of time because of financial reasons or because of many other reasons, apprehension, etc. And for those parents whose first baby has undergone congenital heart disease, and they want to conceive a second child. So for them, we have no source. Both the mother and father should take it before conception. And probability is that the next child would be a very healthy one. There are loads of hurdles homeopath has to face when dealing with cardiac cases. Unfortunately, there's no formal practical training for managing emergencies or acute cases in cardiology or even chronic cases. The homeopathic remedies are not proved to the level of biochemical or pathological changes. Only the proving has been done for clinical observations and clinical symptomatology. This makes a very difficult task for us. Unlike allopathy, who's got pathological provings in the clinical trials on animals and then on human beings. The drug selection in ICCU, when we are called, becomes very difficult because we have got less time. Artificial settings are there. We have got no PQRS symptoms, peculiar cure rare symptom, which is the monopoly of homeopathy. If I get that, I can prescribe a correct homeopathic similimum. But then in an ICCU setting, I am unable to do that. Patient is already on allopathic drugs, which I cannot stop. We don't get a full case. Only for a particular symptom we are called for, and that too at the last stage when allopathy has failed, then the relatives come to us. Doctor, do you have something in homeopathy to save life? That's the time when homeopathy has to go and then still then prove his credentials well and his pathy well. That's what we can still do. Legal implications. As of now, BHMS don't know the value of S. You don't know whether you can handle emergencies, operate a ventilator, give IV transfusions, give blood transfusion, issue a death certificate. Are you covered under Consumer Protection Act? Many homeopaths are unaware, untrained. This becomes a lot of problem when you're practicing cardiology. My dear friends, work on this. Work on this because we, in a small place like Nagpur, for past 20 years have been doing a job, a tremendously heartwarming job. And I don't want this to be restricted to me alone. Let this flow continue to the entire world. Let it be an epidemic of homeopathy. Thank you very much. Back to Karthik. I am ready for any questions if you've got.
Yes, now if anybody wants to ask, Dr. Choksi's put up a request to ask. So if anybody wants to ask, they can either send a message or they can use their video and their audio to ask for the message, ask for the questions. There are two. Wow. Everybody is very happy with this talk, and I think, which is the best potency to start in a cardiac case, doctor? Are you able to hear me, doctor? Aadil? Are you able to hear me, doctor? Aadil, are you able to hear me? Now, can you hear me, doctor?
Can you hear me?
Yeah, I can hear you. Can you hear me?
Because I can't hear you.
Oh, okay, okay. Have you got your speakers turned on, doctor?
Exact.
Doctor, have you got your
What? Yeah.
your speaker turned on?
Yeah.
Now can you hear me?
Yes, yes. Very well.
Okay, okay. There's a doctor who's asking Dr. Adarshine Which is the best potency to start in cardiac cases?
Well, the potency in cardiac cases depends upon why the reason for it. Number one, are you giving a constitutional medicine for curing a case? Okay. If you're giving that, then you would start with a moderate potency, say 200, if you're comfortable working in a centesimal scale, and ascend it to 1 m, 10 m, depending upon the case in a given period of time and giving the medicine. Or if you're working in LM scale, if you're comfortable in that, then you would like to start 0 by 15 or 0 by 16, 0 by 17, one dose, and then go on to 0 by 18, 19, 20 as and when you feel fit. So that is the starting potency for a curative prescription. If you have an emergency prescription, then if your similimum is there, it's absolutely matching. Use the highest potency. Start from 1 m, 10 m, or 50 m, and then ascend up. Again, if you have a pathological prescription, like you know that's hard, and you don't know symptoms are just matching, you just want to give a drug, then you give very low potency or other tinctures to be safe side. Once the patient tolerates it, then you send potency. I hope I have made myself clear as a
Yes, doctor. The next is Smita Mahajan wants to know, how do you prescribe in ICU when we can't take the case?
It's very well. Prescription as in ICU is a totally different ball game. Number one, in ICU, first thing is you have to be aware with the homeopathic history before you enter. Like suppose if you are going to see a patient, you should always take the case pre-hand before going and entering the ICU. That means you should know something about the mental state of the patient, why the patient has landed in the soup. For example, the patient has come with a heart attack. So what was the event? Let me give an example. A 65 years old male has been admitted, say yesterday afternoon with a heart attack, and I have been called today afternoon, and I've been called. Now either the relatives calls me or the ICU person calls me, whosoever calls me. But before I enter, I would talk to the relatives, if possible, what has happened before the event took place. Any mental event has taken place or not? Some insults, anything. If the relatives know, very well and good, then I would basically want to apprise myself of the basic mental state of the person. How is he? How is the basic appetite, thirst, urine stool, all that your husband or wife can answer on the behalf of the spouse, or the children can answer on the behalf of the parent, and vice versa. Now with this in hand, I should go equipped well with my eyes. I should see the state of disposition. Is the patient very restless? Is the patient very calm? Is the patient very complaining? Is the patient very apprehensive? Is the patient himself or herself asking a lot of questions? Is the patient interested in getting himself or herself treated by me? So all these depend on state of disposition. Then I should directly target, because since I have got very little time, I should target on the questions, like particularly the ailments from. Because neither the relatives nor the patient are aware of this, why this has happened. Very few people are actually aware that a homeopath can answer this question, because they're focused on, doctor, I've got chest pain here, I've got chest pain here, I've got vomiting, I've got nausea. You can't rely on those things, because they are not only the symptoms of the disease, they can be the symptoms of the drug given to the patient at that period of time. Many drugs can cause side effects. So today you are going to see a patient who has got multiple symptoms, because not only of his disease as of now, the previous disease also, which he may be suffering from, say diabetes, etc., or the drugs also given allopathic and Ayurvedic or something else, and the mental state. So all these together can give you rise of symptoms. So all these symptoms cannot be treated. So you cannot take symptoms, all these symptoms, repertorize them, and give them a drug. That is wrong. The best guide is ailment from. Suppose if you don't get guide from ailment from, then predominant symptoms which should be complete. Chest pain is not sufficient for me. Chest pain extending to the left arm is good for me. Chest pain aggravated during when the doctor comes to test my blood pressure, that is important. Or when I'm going to get a needle punctured, that is important, chest pain. Other than times, no. Or with meals, without meals, that is important. Some modality should guide me to my acute prescription. Again, if I'm unsuccessful even in that, then I will see state of disposition and the mind, how the patient is lying. If I can gather is an aconite state or arsenic state, then there are few remedies. So all these things together can help you to select a case or a remedy for an acute prescription in an ICC, whatever the case may be, cardiac, non-cardiac, whatever.
Yeah, the next is from Soumya. What is the limitation of homeopathy in cardiac cases?
There are limitations of homeopathy in cardiac cases, not of homeopathy.
Okay, that's a good one. Now, Dr. Varada wants to know whether she can use Arjuna mother tincture and how long she should.
Mother tinctures, particularly Arjuna mother tinctures, has got 3 classical uses in homeopathy. It is the remedy of choice for reducing dyslipidemia, which has been well documented in numerous studies, including a study at R. Second, it has very, very good diabetic control, much better than any of these so-called Cipilendra or whatever given, the CGGM and all those give. I don't give, so I have difficulty in recollecting those names. Third, a very, very good control of hypertension. And fourth, it is a good control of anginal episodes. When you start giving Arjuna, you have a very good decline in the symptomatic state. And fifth, again, a very, very good diuretic as well. So along with heart disease, suppose you concurrently have a kidney disease, again, that is very well controlled. So Arjuna becomes really one of the very good medicines. Now, since it becomes a pathological prescription, you give it mother tincture form, you can give it as long as 3 to 6 months and see the effects. But when you're giving Arjuna, try to reduce other symptomatic drugs, like, for example, statins. Arjuna equals statins. So why do you need statins and Arjuna? In fact, statins are going to give you lots of other symptoms. So be bold enough. Ask your patient. Don't do it yourself. Ask the patient to ask the cardiologist and prick the patient, because the cardiologist is not going to reduce that. So prick the patient. Actually, brainwash the patient to stop all these drugs, and you'll be successful, because Arjuna alone is many times very helpful.
The next is from Manju Singh. What's your experience about CAD recovery?
Fantastic. The very fact that for 20 years I have not left homeopathy cardiology means to say that the recovery is good. Otherwise, however qualified you may be, you have opened a hospital, but you're not getting results, you're bound to shut the shop, right? But not only my business is growing, but my confidence, my business, and my associates all are growing because of homeopathy cardiology. For the very fact that coronary artery disease has got excellent results in homeopathy without surgery as well. And even after surgery, even after angioplasty or bypass, if there's a recurrence rate, restenosis rate, to prevent restenosis, and once the thing has restenosis, then to maintain the patient, because it's a very pitiable state. A person who's invested his time, his money, and the expectation that I will get well with this surgery, and now after say 1 month or 1 year, I'm again, that thing is blocked. Just imagine my state. It's a very sad state of affairs. And that the cardiologist or the cardiothoracic surgeon will clearly say another surgery is important. For them, saying is very easy, but just imagine the state of the patient. Now, if homeopathy can help here and maintain your patient, and not only maintain your patient, but maintain a good lifestyle of the patient, make him walkie-talkie, let him go to business, let him play sport, let him enjoy life only with homeopathic drugs, I think this is nothing but a miracle.
The next is from Dr. Libin Job. For acute angina patient, when you have very limited time, how do you select the medicine and the potency?
Hi, Libin. Libin is my student basically. So he knows very well how I select. He's worked with me. Very well said. Thank you for asking, Libin. Number one, why do you always say we don't have time? How do you decide that you don't have time in a migraine patient? Why don't you say that you don't have time for DNS or for that matter oral ulcers? You always have time. What is important is for every physician to make use of time. Make use of time for selecting a PQRS symptom, something uncommon. And for that, you need to delve into materia medica day in and day out. See, the eye sees only what the mind knows. So if you know your materia medica well, if you know your knowledge of disease well, then you can identify a peculiar, cure, rare symptom very easily from the common symptoms. If you don't do that, then you can't grow as a homeopath in any field. Forget about cardiology. So don't say you have limited time. Say that you don't use the limited time well.
Okay, then that was a good answer, doctor. The next is Dr. Pratik. So he's asking for regarding atherosclerosis drug like Oliganum. When do we start it? Or is it the first drug of choice?
Yeah. Now this Pratik has been seeing my videos, I believe, my Homeopathy Unlock series. So yesterday itself, in the old age, I mentioned Polygonum. Polygonum basically is a very rare drug. If you don't know about this drug, but like terminal Arjuna, it's a fantastic remedy to maintain. Even we have got studies where it decreases the atherosclerotic plaque. We have got angiographic studies before and after giving 8 to 9 months of Polygonum. There is no time to give. You can start anytime. Anytime is good for you. Moment you know about the drug, you start. You can always start it even with the patients on allopathy or other homeopathic drugs. But if it is on homeopathic drugs, do not give it on that day of homeopathic remedy. For example, suppose the patient is on, say, calcaricab, and the calcaricab is a dose of, say, weekly dose of Sunday. So don't give on Sunday. Give on rest of the days. So I think that's all the problem.
Okay, this is another person who's seen our live stream on Facebook. Dr. Neetu Bindra Arora would like to know, how do you decide on the dose of Arjuna?
To decide the dose of Arjuna, 10 to 15 drops of any tincture, morning and night or once a day, is fairly sufficient.
All right,
if it's a mother tincture. Second thing, suppose if you have given it in potency, many people only think terminal Arjuna as a mother tincture, but it's a very good drug for potency as well. But problem is, it's not proved homeopathically. No one has tried to prove. We have a book, Indian Provings in Homeopathy. I mean, Indian drugs are proved, even by CCRS. But I have not come across any proving of terminal Arjuna as of now. So till we don't have this proving properly, because many times the action on the tincture form and action in potency differs. So 10 to 15 drops twice a day or once a day is more than sufficient.
Okay. I think that's about it. As of now, we have only these. Yeah. And Dr. Sureka Ishwari would like to know about repetition of the medicine.
Well, that's a lecture by itself. How do you repeat homeopathic drugs? Again, two broad guidelines. Number one, when you're prescribing constitutional medicines, you don't repeat it till the action of the first dose is over. Meaning thereby, that you, for example, lycopodium has an approximate action of 3 to 3.5 to 4 months. So whenever you're reading the materia medica at the end, you will review the action, an approximate action has been given for each drug. That is when you're giving constitutional medicine. When you're giving acute medicine for acute state, the first thing you should observe is an elimination. For example, you're giving medicine for cough. It's a dry cough. Moment you give a drug, say for Hippursulf, I start coughing and now I start coughing with a phlegm. That means I need a repetition now. The first dose is over. It has done its job. Eliminations are very, very beautiful methods of guiding us to repeat the dose. Till that time, don't repeat the dose. In an emergency, it's an acute emergency, and you're giving a so-called partial similimum, then you have to hammer the vital force more frequently. For example, you're giving a shock. So till the BP comes up, you are entitled to give in every 5 minutes, every 10 minutes, every 15 minutes. For example, Viratrem alb in shock. You know it's a Viratrem alb case. but the patient is not coming up, you're entitled to repeat every 5 to 10 to 15 minutes. So the type of the case decides the repetition.
Dr. Adarshan would like to know what is your experience with Adonis?
Oh, recently I've presented a case, paper on Adonis work. I've compared digitalis as the milestone with strophanthus, with the Adonis work, and Fasciolus nana, the three other remedies for congestive cardiac failure. An excellent remedy for valvular heart disease, failures because of valvular heart disease and right heart failure. It's a very specific remedy, and you get results within hardly 4 to 5 months of a persistent use of Adonis work. So it's good, and you can use both in potency as well as in but low potency, and frequent repetitions and more tincture also.
Yeah, I think with this we come to the end of the session. I'd like to thank Dr. Adil for this wonderful lecture of introduction of homeopathy to cardiology.
Thank you so much
I
for
think
giving me
we've
a
got a
chance to come on your
huge,
show.
yeah. So I think we'll have a series of talks, Dr. Adil, on each facet of cardiology,
Hopefully,
and
yes.
we hope you'll be happy to share your
Yes.
knowledge with all our viewers. I'd like
Sure.
to thank all the participants as well for joining us for the seminar, and hope to see you next Wednesday. And once again, thank you, Dr. Adil.
Thank you. Like before I go, Karuna se
Yeah.
Dorona, be safe and be healthy.
All right. Thank you.